I think in our industry, we as audiologists kind of keep one eye on the, this is a really cool technology, let's see what happens, and one eye on the, is this going to replace me in the clinic?
Right?
Sure.
Because we're already... I don't know why this hearing aid is coming with a full-blown human robot right now. That doesn't feel
exactly.
good to
You
me.
never know what's going to happen.
Welcome to the Ask an Audiologist podcast. Real audiology white papers and real audiology topics explained to you by real audiologists and a guy who isn't. Now here are your hosts, Dr. Jordan Strong, Dr. Michael Squires, and Kevin Ziener.
Welcome back to another episode of Ask an Audiologist. I'm your host, Kevin Ziener.
I'm Dr. Jordan Strong.
And I'm Dr. Michael Squires.
And today we have brought both doctors in to talk to us about the future of audiology. Both of you were at AAA back in April, and so you got to see all the cool gizmos and gadgets and future perspectives of what this industry is going to be. So I think we should take today to discuss about all the fun, innovative, unseen things that are going to take place in your practices and in the field together. So I know very little about what is going to take place in your practices. You two know a ton, hopefully. So Dr. Jordan, what is something that you look forward to either this year or in the coming years that is going to probably be more prevalent in your usage with your patients?
It's a good question. I think that the one that sticks out in my mind the most, at least from AAA, is probably the one that we nerded out the most about, was ear scanning and 3D printing ear molds,
which you have in your practice, right?
So we have a 3D scanner which takes it takes the three-dimensional impression so that we don't have to use manual impression materials anymore, but it makes basically a digital file of it, so then we can send that off to be manufactured.
And is it just snapping like 1,000 photos at once?
That's exactly what happens. But there's a big difference in just taking the impression and being able to actually do it, manufacture it in your office.
Right, print it right there. Yeah.
So that's what I was going to say. So it can do that 3D scan and then eventually, or is that, I mean, we all know that 3D printing exists today, but is that something that is common yet in practice?
No, not common.
Okay.
Yeah, definitely not common.
Is it?
It's right on the horizon.
Yeah.
I mean, with what was released, and I mean, it was released the day that we were there.
Oh, okay.
So with what was released at AAA, I mean, within the next 5 years, it could be commonplace to say, we broke an ear mold, give me an hour and I'll print you a new one.
That's incredible.
It's incredible.
And what's funny is 3D printing is not new to us as consumers, right? But of course, it needs to probably be approved medically, right, before we can start putting it in patients' ears to some effect, I would imagine?
Yes, I mean, they're particular about which material that they're using.
Yeah.
So I think that they're adding more materials to it.
Yeah, but that is the big hurdle.
Right.
Getting it cleared by the FDA.
Right.
Makes
and
sense.
the acrylic, the UV cured acrylic material that is available right now is already approved by the FDA.
Yeah.
And is used across other medical professionals as well. We're just kind of they are just kind of repurposing it for the use of audiology.
Got it.
Yeah.
All right, what else? What else did we see at the conference, or what else have we heard coming down the pike that kind of excites you guys?
So I saw two things, and it's not something that we necessarily talked all that much about. The first thing that I am really excited about, and it kind of alludes to something I saw on Facebook this week that said, it was geared towards audiologists, and it said, maybe you're not tired of audiology, you're just tired of dispensing hearing aids. Did you see that?
Well, yes.
And so there's this whole new wave within the field of audiology about really dialing down on treatment and how we treat sensorineural hearing loss.
Sure.
We just in one of our previous episodes talked about sensorineural hearing loss and how there's nothing in the medical field or in the medical realm that's designed to treat sensorineural hearing loss other than prescription hearing aids, right?
Yeah.
But with some of the new techniques that are being proposed right now in speech testing, speech and background noise testing, that sort of thing, we can gear or maybe steer plan of care a little bit more effectively.
More finely tuned.
No, absolutely.
Yeah, absolutely.
And so if I'm a patient and I'm sitting here and I'm watching this podcast, I'm thinking, so like, what does that actually look like for me? Is it because we're shrinking the totality of the time in practice, we're streamlining the diagnosis and the treatment? Like, what does that fundamentally look like from a patient's point of view? Or will we even see it? Or is it just something that's kind of happening on the back end with y'all?
No, I think patients will definitely
I
see
think
it.
they'll see the difference.
Got
Yeah,
it.
I mean, I don't feel like it's gonna be as much the day in, day out regular testing that a patient would see today.
Sure.
I think it's gonna be a lot more of real world type of testing
Got
that's
it.
gonna happen.
Sure,
Yeah.
and I think that what it means for the patients is, so in our worlds, and you might recognize this in a different way than I do, but we have the patients that have what I refer to as like run-of-the-mill hearing loss. Like they have hearing loss, they recognize that there's an issue, they're motivated to treat this issue. You fit them with hearing aids, you verify the fitting, everything is like perfect, and they're all happy, and these are the ones that are leaving 5-star reviews, and they're happy. And then you have a subsection of patients that are cyclically coming back into the clinic going, I just don't feel like I'm getting what I need out of these.
Yes.
And so we as providers have to be able to say, are they not properly counseled about the expectations that
Correct.
we should have based on their brain's ability to process speech,
Sure.
for example? Or are we not lifting up every stone that we can? And some of these new testing protocols that are being proposed help to just lift up some extra rocks, because it'll for the most in my world, the most direct example would be cochlear implants.
Got it.
It would take a patient who at first glance may not have been readily identified as a cochlear implant patient,
Sure.
and move them right to
Got
cochlear
it.
implants much more quickly. We could say, it doesn't look like you're going to receive the benefit that we are trying to achieve with hearing aids.
Yeah.
Yeah.
Let's do a cochlear implant evaluation and see if that might be an
Speed
appropriate
up that
next step.
timeline
Yeah.
a little bit.
Absolutely.
Got
And
it.
get them, because if you can speed up that timeline, you can speed their outcomes up so much better, and their outcomes are so much better in the long run.
That's awesome.
Correct. Yeah.
And I know your practice deals with Lenire, and which
Yes.
is cutting edge by every metric. Is there anything tinnitus related or some advancements internally with Lenire that you're excited for? Or are we just seeing more data to have a better understanding
Yeah, I
of it?
definitely think we're at the point right now where we're just collecting more data.
Got it.
You know, it's still so new.
Sure.
We're still learning so much about it, and just collecting more data.
Yeah.
I mean, I think it's one of those things where it's like time will tell.
Yeah.
Yeah.
Obviously, something that's near and dear to my heart that resonates extremely well online is cerumen removal, earwax removal. Were there any new gizmos and gadgets that you saw that you're like, oh, maybe not perfect yet, but down the road if they iron it out a little bit? Because I know, I mean, a curette is a very normal thing. Tweezers, you know, the irrigator, of course. But was there anything that you saw or know of that you're like, oh, this could advance?
I saw a really great video otoscope.
Oh,
See, the problem
yeah.
I find
Yeah,
with
the video
the problem I find with video otoscopes for cerumen removal is that they're too big.
Yeah.
They get in the
They're
way.
always way too bulky, and
Yeah.
you can't get two things in
Sure.
there at
Yeah.
once. And so there is one that's on the market that not very many people use, but it's an otoscope that it's shaped a little bit like a pistol. This isn't the one I saw.
Okay.
But that you can feed the instruments
Through
down
it.
Sure.
through,
Through it,
which
yeah.
is perfect, except for it's just
Huge.
bulky.
Yeah.
Yeah.
And so the one that I saw at AAA, it looked like a little pen, and it was very, very skinny.
yes.
And so the camera portion of that is long and skinny, and you can get it in there and hold it in place and
Yeah.
stay out of the way, and then you can go in and
Yeah.
remove that
That's going to be
cerumen
super
around
helpful.
it. Big help.
And so I think the
Not inexpensive, but big help.
Yeah.
never inexpensive. I think one of the last logical points to touch on is listening device technology, right? Clearly, manufacturers of hearing aids are making advances leaps and bounds every year, and they're just kind of hopping over one another, and the technology is catching up at such a rapid rate. Is there new features, and I don't even think we've talked about it on this podcast, but like AI integration into hearing technology that's maybe not around today, but is clearly being brought to market eventually? Is there something along those lines?
I mean, there's already some AI that's out there currently
Okay.
within hearing aids, but I mean, it's growing. Like you said, I mean, it's
Sure.
just rapid, and all the other manufacturers are going to catch up to that as well, and it's only going to get better from here.
Got it.
Yeah, machine learning and artificial
Yeah.
intelligence have been around for a while in our industry. It's just the use of those
Right.
types of technologies and how those technologies are being applied
Yeah.
to make our jobs a little bit easier, but also making listening effort for the patient easier as well.
Sure.
I think in our industry, we as audiologists kind of keep one eye on the, oh, this is a really cool technology, let's see what happens, and one eye on the, is this going to replace me in the clinic?
Right, yeah,
Right?
sure.
Because we're
Like,
already,
I don't know why this hearing aid is coming with a full-blown human robot right now. That doesn't
yeah,
feel
exactly.
good to
You
me.
never know what's going to happen. I mean,
And not every patient is okay with it.
And not every patient is good with it. No. The GPS functions, the
Yes.
Find My Hearing Aid functions.
Some of them are not comfortable with that.
No,
Yeah.
and we still want to make sure that our patients have a choice.
Sure.
Yeah.
So one thing that we have noticed, or that I have noticed, especially with cochlear implants, is they're taking away the use of things like multifunctional remote controls.
Oh, yeah.
And they're putting everything on an app.
Yeah.
And
Yeah.
the patients are going, I don't want to use an
Right.
app.
Yeah.
I want to use a remote control.
Sure.
And so we're having this like struggle, this power struggle with patients,
Yeah.
because in cochlear implants, they upgrade every
right.
so often.
Okay.
And so they're upgrading out of the use of something like that
Got it.
technology. And
Right.
so, we're seeing that kind of all dotted across our industry. But
Yeah.
that is the future. That's technology, and it's not going to slow down at any point in time.
Right, and I feel like as generations come, with age, that more and more
Right.
people are
Sure.
accustomed to having
Yeah.
that type of technology.
Yeah.
Of
Our
only
patients are
being an
going to
app.
be our patients are going to be of the age of
Yeah.
technology,
Correct.
and they're going to expect
Right.
everything to be,
be on a phone.
On a
Yeah,
phone.
those little rectangular devices in
Yeah.
our pockets help speed the learning curve.
Right.
Yeah, for sure,
generations.
Yeah.
for sure.
I
And
imagine.
one last point that I wanted to make: our patients are of that age too, but man, there was a lot of students walking around AAA. That was the second point that I was alluding to
Yes.
earlier. Lots and lots of students, and I love that. As a professional, sometimes it's difficult to get out of the clinic, take a week and go and do that sort of thing. We are lifelong learners. We love to go to those events. We love to catch up with people that we haven't seen for a long time and learn stuff. And it's hard to do, but it's really great to see students actively wanting to do that.
Yeah.
Yeah. Our future, the audiology's future is bright.
It definitely.
Good. Yeah.
Yeah.
Well, to learn more about the advancements in audiology, feel free to head on over to Ask an Audiologist. And thank you to both of you for being here today.
Happy to be
You
here.
bet.
You have nowhere else to be. You're
We're
legally
stuck
to this
here.
podcast. We'll see you guys next week.
Take care.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.